Many thanks for joining us here on Just Nigeria, brought to you by the BBC and Channels Television. And here on the program, we keep an eye on all the stories that matter to you. I am Wale Fakile. Let's start with our top story. In the first 9 months of this year, about 3,000 people have died of not COVID-19, but cholera infection in Nigeria. The World Health Organization says if left untreated, cholera could kill within hours. The Nigeria Center for Disease Control says the disease has spread to 28 states, but both Jigawa and Kano are the worst hit. At least each of these neighboring states has recorded more than 300 deaths. In this report, we visit both states to see how residents are coping in the face of this ravaging disease and efforts of authorities to contain it. Viewers' discretion is advised, as some of the visuals in this report are disturbing.
We have over 81,000 cases with over 2,700 deaths.
An outbreak so deadly.
We lost 48 patients.
Thousands have been killed.
Some days we take like 60 admission.
Hundreds more have been hospitalized.
We have 28 states plus FCT that are affected.
It's ravaging more than 20 states across the country.
And is even at an alarming rate.
The disease is a killer, a silent killer. And no, it's not COVID-19. Nigeria, like many other countries, is dealing with the third wave of the coronavirus pandemic. But while authorities were racing against time to vaccinate more Nigerians, a different outbreak equally as deadly crept in. Cholera, a waterborne bacterial infection, causes diarrhea and dehydration. It kills fast if not treated on time. Since January 2021, the number of cholera cases and deaths has been climbing rapidly across the country. More than 2,500 people have been killed so far within 9 months in 28 states. Jigawa, Kano, and Ogun are some of the worst hits. Jigawa in northwestern Nigeria has the highest cholera-related deaths in the ongoing outbreak. Local and national health officials say at least 423 deaths have been recorded so far in 19 of the 27 local government areas in the state. Behind these crime figures are real families struggling with the void of losing a loved one.
This child is always with him, so when he got infected, he also got infected. And I went to the chemist to speak to the pharmacist there, and he said since they are both vomiting, they should be taken to the hospital.
I was called that my brother came back from the farm and was stooling. So I put him on the bike and took him to the hospital. The hospital was filled with too many people, and they told us there was no bed, so we put him on the floor. The hospital staff took care of him and gave him drip. I was not there when he died because I had to return home to take care of my family.
While help might not have arrived for some, others were a bit more fortunate. This general hospital has been taken in and treating sick residents, but the reality here is overwhelming. The patients are too weak to speak, and just outside one of the wards, the latest casualty is wheeled away. His family devastated.
We discharged at least more than 1,832 patients that are totally cured from the cholera. And unfortunately, we lost the number of 48 patients up to the time of this record.
Go and do what I said. Follow my directive.
Authorities here say more than 2,000 people who contracted the disease have been hospitalized in the last 2 months. While some have been discharged, there are hundreds who don't have access to potable water, putting them at risk of getting infected.
Jigawa is one of the flood-prone areas, so it's likely after we have open defecation, the water can The flood water can take this bacteria back into our water sources, which will be ingested by people, and then it may lead to cholera.
Cholera is something that we shouldn't be even talking at this level of our development. We are 61 years. I mean, what are we looking for? Basic things of life. If water is not available, safe potable water that people can use, can drink, can use to cook, then what do we expect?
The reality in Kano State is stark. The outbreak has been spreading hard and fast since March. Jigawa's northwestern neighbor has the third highest number of casualties in the country. According to official figures, 311 people have so far died from cholera at the time of this report. Local health authorities say more than 5,000 suspected cases had been recorded since March.
There is an executive order that there should not be open defecation in our communities, but is it being implemented? Even if it's going to be implemented, there are some enabling environment that should be provided.
Southern Nigeria has not been spared from the ongoing outbreak, though not as deadly as been experienced in the north. Official data shows that Ogun is one of the 18 states with active cases of infections. There have been 34 reported cases so far, with the death toll standing at 12, the highest casualty tally in the south. A visit to the epicenter of the outbreak in the state suggests the situation is now under control.
When we realized that the cases were increasing, the community had to step in. We contacted the Commissioner for Health in Abeokuta. They came and fumigated our community.
The state government has urged residents to maintain good hygiene, but the reasons for the outbreak here are not far-fetched.
We have not put in structures in place. Structures for water to be available for everybody. Structure for refuse disposal. Proper refuse disposal.
Nigeria has previously experienced large cholera outbreaks, including those in 1991, 2010, 2014, and 2017. But there are concerns this outbreak could eclipse the death toll from previous epidemics. The case fatality rate of the current crisis is 3.4%, more than double that of the coronavirus's 1.3% in Nigeria. The death toll from the ongoing outbreak is pegged at 2,791. COVID-19 has killed 2,723 in almost 2 years. Experts worry that the current death toll may be an undercount, as many affected communities are inaccessible due to security risks. The Nigeria Center for Disease Control has been leading the national response to the epidemic.
The cases are reducing. We have a reduction from week 36 to 37 by about 34% reduction in the number of cases. And basically it's because of the interventions that are being carried out. The government of the states need to provide potable water to their people, because sometimes it's not the fault of the people.
Health seems to have the consequences of all these inadequate policies or poor policies. If there is no toilet, toilet is provided by another ministry. Water is provided by another ministry. Transportation, another ministry. But the consequences of not doing the right things in those monies affects health.
Cholera is endemic and seasonal in Nigeria, as access to safely managed drinking water is still a challenge. UNICEF estimates that over 46 million people practice open defecation in the country, increasing the risks of cholera outbreak. Although the COVID-19 pandemic has stretched the country's healthcare system, the ongoing cholera outbreak is a public health emergency, one that requires urgent preventive and containment interventions. A public health emergency indeed.